Okay, I think one of the most important results so far is that patient participation in research has actually been more than we anticipated when we were judging the grant proposals. And I think that's a very good sign. And it also implies that it's very important to have the patient's perspective included in research. And I think that's a very nice yield from this program. And I think another result is that even though there are many different rare diseases with very many different medical aspects to be taken into account, that when it comes to experiences with care, but also experiences in daily life, there are many similarities across all these rare conditions, and that this is also something that we can use to bring results from the research further, because these common results can also help to impact daily practice. I think many of the projects suffer from ethical problems when they have to ask for ethical approval from the medical ethical committees, because these committees are not used to this type of research. They're not used to social sciences research, and they tend to ask many different questions, make it very difficult and hard to get the approval. But also it has to be applied for in many different countries, in different settings, in different hospitals. So it takes a lot of time. Legal obstructions have been very serious for many projects. I don't really know what the solution towards this is. Perhaps this could be a focus of attention for European committees to work on a more joint approach when it comes to ethical approval for this type of research. And also many committees are not used to patients having an important voice in research, and this also makes that they are very unfamiliar with this type of research. So I don't know the solution to this, but it is really something for the future. We really need to change our view of what good research is and what good clinical practice is. I think it was very good in this call that they obliged the people who want to receive a grant to work together between social sciences and humanities and also clinical practice. And I think this is a way of bringing these two fields more together. And I think this has really helped to improve the proposals. You can also notice that it still takes up a lot of time and effort to come together and have the similar approaches. So I think it's very useful that the European program has focused on this type of research, but we're only in the beginning. I think this should be expanded and this should be continued, and I hope that in the new program this is going to be one of the focus points as well.